Good afternoon, everyone. I want to welcome you all to Maine Public Health Association's 2017 webinar series. My name is Becca Bolas, and I am the Executive Director of the Maine Public Health Association. I want to give you just a brief introduction, and then I'll turn it over for today's presentation. So the goal of MPHA's webinar series is to feature and promote ongoing public health work in Maine, including accomplishments, current events, programs, and resources. There is much exciting work in our state and much to celebrate. So if you are interested in being featured in one of our webinars, please let me know. We are grateful to the Maine Area Health Education Center and the New England Public Health Training Center for their generous support of these webinars, which are an educational opportunity available to anyone interested in public health in Maine. Shortly, I will turn it over to Jared McCannell, who is the Volunteer Management Coordinator for the Maine CDC's Public Health Emergency Preparedness Program. Jared will be presenting today about Maine Responds, which coordinates healthcare and emergency response volunteers into a single database that can coordinate the need for volunteers in case of a public health emergency or natural disaster. If you have a question while Jared is presenting, you can use the chat feature by clicking on the gray call-out bubble box, which is in your gray conference call box. I will try to moderate as best I can. If I'm unable to get to your question, then I'm sure Jared will be happy to have you contact him after the webinar. And the last housekeeping item is if you want to minimize the conference call box, there is a gray arrow that's pointing toward the left on the right side. So if you click on that, it'll minimize your box. And with that, I want to thank you very much again for joining us today, and I will turn it over to Jared. And just make sure you unmute yourself, Jared.
Hi, can you hear me now?
Yes, we got you.
Okay, great, thank you. Well, thanks for having me. Like I said, I'm Jared McCannell. I'm Volunteer Management Coordinator with Maine CDC. I work in the Public Health Emergency Preparedness Program. My main role with the PEP team at Maine CDC is to oversee our ESAR-VIC program, which I'll get into in a moment what that stands for. And we can jump right in, talk about volunteering in public health. So Maine Responds is an umbrella program that oversees a number of different types of volunteers in Maine, including federal volunteers, folks that want to volunteer during a federal disaster in public health, or people that want to be on the state team, as well as folks that are interested in working locally in their communities through things like Medical Reserve Corps or other strike teams. And then we have other strike teams, including Maine Disaster Behavioral Health, which was recently added to this. Essentially, Maine Responds is the single registry for all public health volunteers in Maine that are interested in helping out during a disaster that has any sort of public health ramifications, which, as most of you might know, any major disaster is going to have a public health component, whether it's cleaning out basements of mold after a flood or something that's more typical of public health emergencies like a flu outbreak or something like that. Regardless, we need to know what sort of volunteers are available, who they are, what they can do, and be able to communicate with them. And that's essentially what Maine Responds is. It's the registry that folks can pre-register on with the state, and then we can follow up as needed. So before we get started, I want to talk a little bit about what ESAR-VIC is. And it's a long acronym. You'll hear me say it again and again. That's simply because trying to say emergency system for the advanced registration of volunteer health professionals is far too much of a mouthful to say and keep this webinar within the allotted time. So ESAR-VIC is the federal program that came about right after 9/11 when lots of folks had gone to New York to help out during following the attacks on the World Trade Center. And so what ESAR-VIC does is it works with states to establish a national network of state-based programs for pre-registration of volunteer professionals, volunteer health professionals. working within this network of verified credentials and up-to-date information, volunteers are able to serve at a moment's notice within their state or across state lines to provide needed help during an emergency. Now, that's fantastic that we have this program. However, if anyone's ever done any amount of volunteering, you know that if that volunteering isn't meaningful, if you don't stay engaged, it ends up becoming something that slips to the back of your mind, and maybe it isn't as important. So when you sign up originally thinking, oh yeah, I'm going to get involved and help out, but then if you don't hear from anyone for a couple of years, maybe you change your address or a new email or a job, and suddenly you're not on the registry, or we don't have the right information. So although having a state registry is a great idea, there's a lot of work that has to go into keeping people engaged between disasters. So eSRVIP got started right after the attacks on the World Trade Center in September 2001. And what happened was tens of thousands of people traveled to Ground Zero to help out, which was fantastic. It's human nature to want to help out during a disaster, and people know that. Unfortunately, most of those folks that showed up were unable to participate because they couldn't be distinguished from those who were qualified from those who were not. No matter how well-intentioned these volunteers were. You can imagine how frustrating that would be if you are a volunteer and you're going to help out and you're stopped at the gate saying, no, you can't go in there. But it's also frustrating for emergency management personnel who are trying to secure a scene and make sure that only the folks that need to be there are there, and they're having to spend time and energy and resources interacting with people showing up that want to help, but there's no way of really knowing who they are. So it's frustrating on both ends, and it's also a huge vacuum when it comes to resources, because now you're dealing with personnel that are interacting with one another that could be doing other jobs to support the response effort. So that's part of the reason that this program was started. And since then, we've had a few other major incidents where eSRVIP volunteers were called from out of state, including disasters like Sandy or Katrina. Again, what people realized was that, having state registries and lists of people that were willing was one thing, but having people that were ready and able to engage and mobilize was quite another. So here in Maine, we call eSRVIP Maine Responds. It's just a lot easier to muster, a lot easier to spit out than the emergency system for advanced registration of volunteer health professionals. But for all intents and purposes, when I say Maine Responds, I'm talking about the eSRVIP program here in Maine. And if I say eSRVIP, I usually mean on a national level or a grand scheme. But they're otherwise synonymous or interchangeable in this presentation. Maine Responds essentially starts with a website. If people are interested in signing up to be a responder, to be a designated volunteer during a health disaster, they simply go to this website and they can create a username and password, log in, and register that way. In there, what we want folks to do is simply share their credentials, any licensing they might have, professional licensing, and a few other personal details, contact information, other information about emergency contact. If you're deployed and we have to contact someone to let them know that you're going to be a few days longer or something like that, we want them to have that information in there as well. But otherwise, it's a really simple site. There's not a lot to it, and it's designed that way because they really just want to get people in there as easy as possible without having a lot of distractions. So one question we often ask during our volunteer orientation, which this presentation is based on, is why else might we need a single statewide volunteer registry for healthcare professionals? And the answers are pretty simple. Although there's lots of reasons, there's three that we really focus on: protecting the public, protecting volunteers, and then, of course, protecting healthcare institutions as well. So there's really three levels that we're looking out for folks. In regard to protecting the public, we work with trained and qualified volunteers. So these are folks that have already achieved a certain amount of expertise in their field. So, they will have a degree, either a medical degree or some sort of other specialty, a certificate, some sort of license or qualification, credential. This allows us to move assets around the state as needed to provide that continuity of services. So if there was a major flu outbreak that was really focused on, one hospital in northeastern Maine, the EMHS, we potentially could bring volunteers in from outside of that area to help out during that crisis. Or maybe not to that hospital, but maybe we could have public health volunteers helping to do vaccinations nearby, somewhere outside of the immediate area that the hospital is, but nearby for residents and local citizens to be able to access. And of course, we also can access specialized resources. So if we needed a certain type of surgeon or a certain type of behavioral health specialist, we could look in the database, find out who is available, who might have the right credentials, but also who's the closest, and have backups as well. So we could provide specialized resources as well. So in regard to protecting volunteers, here in Maine, a person holding a professional license in the state may be designated a member of the emergency management forces in that professional capacity, only after the individual is or the license issuer provides confirmation of a valid license. So this statement is part of Title 37B, which protects volunteers that are responding during a disaster when they've been deployed by the state. This usually brings up another question for folks, which is, well, what if you don't have a professional license? Can you still volunteer? And the answer is absolutely. We won't deploy you to do heart surgery if you're licensed to do plumbing or any other profession. We still want other professions that are licensed in their field. We just won't have you do healthcare-related things or perform medical services if you're not capable of that, as outlined in your professional licensing. So we do want unlicensed folks and other people that are licensed in other ways to help out, and we want to know who they are, what those skills are, because you never know. It might be a public health event that doesn't necessarily involve clinicians. For instance, a recent example would be in Flint, Michigan. There was a public health emergency regarding drinking water, which I'm sure everyone on the call has heard of, where lead was discovered in the water after they had switched water sources. Lead leached from the pipes in most of the community, and this was a major public health problem, and it still is. It's still a major public health crisis in Flint. While folks were trying to figure out who was responsible for that and taking people to court and things like that, there were hundreds, maybe even thousands of public health volunteers, many of them part of their state's ESARBIT system, out in the field, handing out bottles of water, delivering drinking water for folks, delivering test kits. Others were licensed professionals, licensed plumbers, I mentioned before, that we wouldn't have them do heart surgery, but we certainly would have them evaluate or assess a situation if we had to replace pipes at a school or another public facility. So there's all kinds of room for volunteers in every capacity to support a public health emergency, and that's why we need to really recruit between and across different specialties. And then finally, protecting healthcare institutions. Anyone that works in healthcare knows that risk management is a huge concern. Not only do hospital systems have teams of lawyers to make sure that they are working within the law and also protecting themselves and everything, but we want to make sure that if we have to send volunteers into a healthcare facility, that the folks that are making the decisions to say, yes, they can come in here, know that we have done due diligence in regard to vetting them, checking their license, doing a criminal background check, which technically isn't part of the ESARBIT program, but it is part of the system here in Maine. So that's a higher level of security that we go through. We do a criminal background check as part of our Maine Responds program. And so that will hopefully help convince hospital personnel that the folks that we're potentially bringing in are trustworthy and qualified people to work with. That's not always the case, but as far as, the people we bring are trustworthy and qualified. It's not always the case that they will let them in willingly, but in certain circumstances, we want to be ready to have the right people if the hospital is compromised and their staff is unable to perform the services that they're supposed to be able to provide. So in regard to training and support, for our volunteers. We have all of our Maine Responds volunteers take a minimum of 2 FEMA online courses. They're very quick and easy. They're independent study courses. They're free. And so that's ICS 100 or an equivalent, which is the Introduction to the Incident Command System. And that's just a system we use here in the United States that allows agencies to fold into a certain structure during a disaster or emergency response that designates the chain of command. So, and this really came about because in some cases, if there, for instance, was a wildfire that jumped county lines, suddenly you're dealing with 2 jurisdictions, not to mention multiple townships or municipalities, and now you're dealing with state and county and local police and so on and so forth. So the incident command system is designed to help give structure that folks could fold into no matter what their role in the response is. And the medical has a big part of that in regard to public health. So we want our folks to simply understand that that system exists. We don't expect our folks to be masters of that and, would necessarily know how to jump in and be incident commander, but we do want them to know that there is a system, that we do abide by a certain set of expectations or rules that help keep order during a disaster. And then also ICS 700 or an equivalent course, which is the National Incident Management System, or NIMS, and that title is just an introduction to NIMS. And so that's essentially, if ICS, the Incident Command System, scales up beyond a local response and becomes a national event, the National Incident Management System would, at that point, be enacted, and ICS is part of that system. So this really talks about an escalating event, something that goes from a local to a much greater event. We like to say that all emergencies start and end locally, but quite often they escalate up to something that's much larger than the initial area that's impacted. The FEMA courses, if you go to training.fema.gov, there's an independent studies section. You can click on that. There's a whole list of free courses to take, and this is similar to the screen that you'd see if you were to go looking for the ICS 100. An equivalent that they offer is the IS, which is Independent Study 100.B, and that's the Introduction to Incident Command System. So there's dozens of other free courses. We only require those 2 because we just want that baseline knowledge, but we would certainly be supportive or recommend that anyone interested in volunteering in public health take as many of these free courses from FEMA as possible, and then you can store that information in your profile. So the National Incident Management System, which I just mentioned, ICS 700 is an introduction to that. One of the things that they really talk about in there are personnel qualifications and safety and also credentialing. And that's exactly where Maine Responds, or ESAR-VIP, fits into the National Incident Management System. Maine Responds serves as the credentialing agency during a disaster for all public health folks. So even if someone isn't already registered, they can log onto our system, enter their information, and we will go ahead and verify their credentials. So although we don't have the capacity or capability to do that instantaneously, we can certainly expedite that process if someone's not waiting for the state licensing board to verify someone's credentials. We can do that in the field in a matter of hours, depending on how quickly we can get that information. And so this program, Maine Responds, fits right into ICS 700's exploration of qualifications in safety and credentialing. If you become a volunteer with us, we actually issue a secondary ID. This is my friend Mary. She'd kill me if she knew I was broadcasting this over the internet, but that's what you get for being my friend. But Mary's fantastic. She's a deputy emergency manager down in Cumberland County, and she did actually give me permission to use her picture at one point. So, but this is the ID that we issue, and essentially it's just a secondary ID because a lot of times security personnel will be asking for a photo ID. If you were in a hurry and didn't have your license with you or some other state-issued ID, this serves as a secondary photo ID. Now on the back, we also have encoded digitally all the information that we have about your credentials in Maine Responds. They're also encoded in the back of the card. So this would allow someone with a state scanner to go ahead and scan you into a secure area, knowing that you are, in fact, the person you say you are and what your credentials are in terms of your ability to respond. So it's a secondary form of ID. You don't need it to respond, but it's a nice backup. So in regard to affiliated volunteer programs, as I mentioned, Maine Responds is really just a list of names. It's just a registry. And if we don't engage folks between disasters, we typically, we risk losing them. So we work with a federal program called the Medical Reserve Corps, and we also have a state program called Maine Disaster Behavioral Health Response Team. And so these two programs are affiliated programs in the sense that their volunteers register with the ESRBIT program. So they will respond in their own capability or their own capacity as they're called upon. But if an event escalates to a state level event, or if the feds request volunteers, we can access these folks through Maine Responds. So typically we'd want someone to sign up for Maine Responds if they're interested in this, and then join a certain strike team depending on their interest, their geographic location, as well as their qualifications, capabilities, or other areas of expertise. So first and foremost, the Medical Reserve Corps is, as I mentioned, a federal program. We traditionally have had two units here in Maine, Unit 115 in northeastern Maine, which is associated with the Northeastern Maine Regional Resource Center, and then Unit 2440, which is Cumberland County Medical Reserve Corps, and they're associated with the Emergency Management Agency of Cumberland County. So those are what are known as the housing agencies. So each of these Medical Reserve Corps units has a housing agency, which is essentially a fiscal agent in the nonprofit world. That's what we would call them. But they're otherwise sponsors or housing agencies in the federal vernacular. Now, recently, as you can imagine, having two Medical Reserve Corps units, one in the Bangor area, one in the Portland area, would not be good enough to cover the whole state during a real crisis. So we've gone ahead and worked with teams around the state, so Maine Responds volunteers, to develop a unit in each of the other remaining 6 public health districts. And so with the 2 that we had already, we now cover all 8 of the geographic public health districts, and we're working with tribal leadership, with tribal public health to do the same for our tribes in Maine. So for the meantime, we have brand new 6 new units that we're trying to develop right now with volunteers from around the state. So most of the folks that were originally just signed up for Maine Responds, we've reached out to them and said, hey, you've got a new strike team in your area, and no matter what their background is, MRC units will take anyone that's interested and like the ESRBIT program will only utilize them for what they're qualified to do, and otherwise will use them in supportive roles. So, which actually is the next question, who can be part of the unit? Essentially, any public health personnel, physicians, nurses, PAs, pharmacists, behavioral health folks, dentists, veterinarians, epidemiologists, anyone in public health or in healthcare, I should say, is welcome to be part of an MRC unit, as well as lay volunteers or non-clinical and non-medical volunteers. And I used the example before of a plumber in Flint. It's a great example of someone who was not a medical volunteer but absolutely essential during a public health crisis. So the other strike team that we're partnering with is Maine Disaster Behavioral Health Program. And so the DBHRT, the Maine Disaster Behavioral Health Response Team, it's a group of professionals, clinicians, spiritual care providers, and other qualified volunteers that help out with behavioral health issues during a disaster. So DBH, or Disaster Behavioral Health, is a set of supportive mental health actions that address survivors' emotional response to a traumatic event in public health emergencies. So during any sort of event, there's always a certain amount of chaos that goes along with that, and traumatic experiences that really have a long-term effect on people. But they also have an effect on how well they can process information and handle a situation in the moment. And so during a disaster, it's chaotic, which causes fear and stress. And if someone's stressed, they have a hard time with simple things like problem solving, focusing, planning, communicating, following directions. And those are all skills that are really needed during a public health crisis for anyone to survive. If you're being told you need to evacuate, because of a flood that's coming or something like that, and people are stressed out and not able to really process that situation. And we've seen this before. We've had people who are in denial, who even after a hurricane were told, you need to evacuate. There's levees that are breaking or breaching, and folks didn't listen. And we've seen it before where it's not that they were not following instructions, it's that they were in shock and having a hard time processing the size of the situation that they were dealing with. So behavioral health is an area that we really feel strongly here in Maine that we can continue to develop to support all of our emergencies, whether they're public health emergencies or other types of disasters. We truly feel that every single disaster has a behavioral health component, and not just for the survivors of an event, but also the responders. There's a lot of examples you might have heard in the media about folks dealing with post-traumatic stress that were responders during 9/11. That's one of the big examples we often use. And this is an opportunity for us to really take care of not just the victims of an event, but the folks that we're helping and that were part of the rescue effort. So the whole purpose of DBH is to improve the adaptive functioning by decreasing stress and providing psychological first aid. So assisting survivors in a number of areas, but the main one being understanding the situations and helping to manage those reactions and helping to gain a sense of control. As folks are supported in that way, they're much more likely to survive an event as well as have lower long-term implications when it comes to the amount of stress that they might be processing during and after an event. So we also work with unaffiliated volunteers. So those are folks that are not part of a strike team like a Medical Reserve Corps unit or the DBH team, but still want to be on the registry. So they're interested in helping out with public health, but they don't want to go to monthly meetings with a local group, or they don't want to participate in other things because they simply don't have time or are not interested, but would be happy to respond during a major crisis. And so we have folks at that level as well. We typically would try to encourage folks to stay involved with an MRC unit and join the local team because they're more likely to be engaged and get lots of extra training and support, which we really feel is a value to the program. Nevertheless, there are always folks that just simply don't have the time to do something like that or live too far away from where the unit might meet. And you think of a county like Aroostook, it's an entire public health district in and of itself, and no matter where that unit's located, it's going to be far away from some of the folks that it serves. So there are situations like that where someone might want to be on the registry but is unable to participate in local events. And then likewise, if someone wanted to be available for federal response but didn't necessarily want to be a state volunteer here in Maine, but was interested in being available if the feds called in support, by signing up with Maine Responds, you can check that box and indicate that you're available for federal response and choose not to respond locally. And then we also have spontaneous unaffiliated volunteers. And this is actually a big reason why we have the system in the first place, is when people show up and they're, we don't know who they are, we can't verify their credentials or identification, they end up just getting in the way, which is unfortunate, but we also don't get a chance to engage them and utilize their support. So we're partnering with groups like Maine, Volunteer Maine and 211 to direct people to sign up for Maine Responds. So if they go to those websites and share with through those platforms that they are a medical professional, they have an opportunity to be directed to Maine Responds and expedite the process of signing up with us. So they no longer would be a spontaneous unaffiliated volunteer, but become an affiliated volunteer in one way or another. Registration is easy. You either create a username or password, or use the one that you've already created to log on to mainresponds.org. One of the very first questions you're asked is to add an organization, and that actually means add a strike team or add a group to be affiliated with, and this is how you become an affiliated volunteer within Maine Responds. So you either join a Medical Reserve Corps unit or the Disaster Behavioral Health Response Team, and we also have other teams that we're adding on there, like Maine Task Force 1. We're exploring the opportunity to work with them because they're also medical volunteers, and this is an opportunity for them to be registered in the same place as other volunteers. So when you click on Add Organizations, it'll take you to a screen that looks like this. And if you just want to be a Maine Responds volunteer with no other obligation, you can just click that top box. However, ideally, we would have folks go down and join one of the other strike teams. Once you have a profile, this is what your home screen would look like, and the profile screen that's associated with that. And this is where we collect all the information that we need to keep your account active. The major things to consider are under occupations, that's where you put your license information. Training, that's where you could indicate whether you've had the ICS 100 and 700 training or other associated trainings. And then background checking. That's an important one because here in Maine we have to have folks background checked to receive the liability and workers' comp coverage. So if you click on that, it'll have you complete a form that asks for some sensitive information, including a social security number. If people were not comfortable transmitting that information over the internet because maybe they're not sure how secure their internet connection is, they can also call the state directly and talk to me, and we can do it over the phone that way. So that's another option for folks that are worried about cybersecurity. We take that very seriously, and the vendor we work with, that's one of the selling points for us was how secure they were to work with in creating the system. The big thing we want folks to remember is to sign up before you show up. We just don't want unaffiliated volunteers showing up, no matter who they are or how skilled they might be. They could be the exact person we need, but we're much better off if we know they're coming ahead of time and we can send them to where we need them the most. And in case you tuned in a little bit late or you weren't listening at all or your audio is broken, ESAR-VIP in Maine is called Maine Responds. And Maine Responds is the system we use to coordinate different types of public health volunteers, whether they're state responders or affiliated strike team folks with a Medical Reserve Corps unit or the Disaster Behavioral Health team. And now is where I would normally take questions, and I'm not sure if Becca can facilitate that portion, if we have questions, or unmute the phone perhaps.
Yeah, no, I'm more than happy to facilitate if other people have questions. I have one to start off. And that is, you were talking about how lay people or non-clinical volunteers, there are other opportunities for them, and one that you included was being an interpreter. And I guess the question I have is, if there is someone who is multilingual, does Maine Responds connect them with additional training? So, for example, if they wanted to become a medical interpreter, is there a way with skills like that to be alerted to additional training opportunities?
That's a great question. Now, Maine Responds itself probably wouldn't, simply because it really is just the registry. It's just the names and data. However, the affiliated teams often have lots of resources, whether it's grant funding, other resources, or just other partnerships with agencies that might be more likely to be able to pursue something like that. So although Maine Responds itself, the only trainings it really offers are directly related to disaster response or public health emergency preparedness, some of the affiliated teams would be much more likely to be able to do something like that. Some of our partners include University of New England, for instance. We're working with them on a couple of different points of dispensing exercises and alternate care site exercises. They're collaborating with the local York MRC unit, which is one of those brand new, one of the 6 new units. And so teaming up with an institution like UNE, they might be able to, they potentially could offer resources that Maine Responds couldn't typically offer.
That's great. And is there a way in someone's profile to indicate if they want additional training, or is that beyond the scope of what you're really looking to do?
That's not in their profile. We wouldn't have that in their profile. We only collect information that, that is currently relevant to their capabilities. However, Maine is a small state. There's essentially one person behind the registry, and that's me, and I'm easily accessible. Most of the emails you get from the system are either coming from me directly or coming through the system from me. And so if people were interested in exploring how to kind of maximize their experience as a volunteer, that's an area that I could certainly coach people through and get them connected with resources that would help increase their ability to be a deployable volunteer with us.
That's great, Jared. Thank you.
My contact information is actually on the last slide, so I would recommend that anyone please jot down it's my office number and my email address.
Can you go back to that slide and just leave that one up?
I'm sorry, the final slide, not the last slide, but the final slide. So it's coming up. It's the next slide.
Okay.
There we go.
Yeah, I would leave that. No, that's great. I would leave that up, and that way people can jot it down. There are 2 other questions that came in. The first is, how do you communicate with volunteers if there is a public health emergency?
That's a fantastic question. So this is where Maine Responds, it actually goes beyond being just a registry for volunteers, but it's also the communication system we use. So similar to the Health Alert Network, we use a product that's created and maintained by the same company that does the Health Alert Network, the HAN system. And so we have the capability to email people directly through that system, and we can do email, text, voice messages, as well as fax, if that's still relevant for anyone. And so we use those multiple platforms and multiple ways of communicating with folks, and we can send the messages out in a blast format where they just all go out. So you'll get a text message, a phone call, and an email all at the same time. Typically, we don't like to do that. We also could do a cascading approach where you prioritize. I'd like to only get texts first, and if I don't respond, then please send me an email. And if I don't respond, then you go ahead and call me. So you can prioritize which method you're contacted by first. That wouldn't apply during a blast email or a blast message because you just get everything at once. But it would apply during a cascading solicitation where we send one thing out before another.
And that's in your profile, right?
Yep, exactly. And so you put in the profile the different contact information that you'd like us to use. You can also indicate if the phone number is also the same phone number you'd like to be texted at. And that's important because someone might indicate that they have a cell phone that they prefer, but they don't click the text box, and then we wouldn't actually text them at that number unless they indicate that. So there's a few little snafus or little tricky things like that any system is going to have a few little details like that perhaps technology is advancing faster than some of the products we're using, but the company we work with is working very diligently to expedite that, knowing that a lot of folks, the same phone that they have is also where they want to be texted, and it's also where they receive their primary email. So with things like that, we're looking for opportunities to make sure that we have redundant communication systems in case someone's cell phone's dead and they can't do any of those things. We also want to make sure that we can reach them on a landline or an alternate email address or alternate phone. So all that's managed through their profile. Typically, they don't have to go into their profile very often, other than to initially put that information in there and then to update any information. Otherwise, all the communication we send to the platform that you've indicated that you'd like to receive the information. So you'd only have to open up your email, for instance.
That's great. Thank you. And then the last question that I've received so far is, so you talked about 9/11 and you talked about Flint. I'm wondering if you could please give other examples of types of emergencies volunteers might need to respond to.
Sure. Well, and a lot of times this question is also geared towards, well, what, can you give me an example of what's happened in Maine? And
sure.
So,
yeah.
And so what it's a good answer, but it's a bad example because Mainers are resilient and typically don't call on people for help. They help themselves, they help each other, they help their neighbors, they prepare. Mainers are typically some of the best folks in terms of preparedness. They'll shop before the storm hits, and they'll know that they need to plow out their driveway before halfway through the storm because it's going to keep on coming and things like that. So typically, we haven't had to deploy a lot of volunteers for major responses, which is a great thing. It means that we're doing something right as a society, as a culture of people here in Maine. However, there are some examples. During H1N1, there were huge vaccination efforts that went underway at the then Bangor Auditorium, or Bass Auditorium, which now is a new facility, the Cross Center. But essentially, public health nursing, Bangor Public Health, and other associated volunteers and teams of people came together to do that. One of the groups that supported that was the Northeastern Maine Medical Reserve Corps Unit, Unit 115. They were a part of that. So they didn't manage the entire thing themselves, but they folded in to support that effort. And that's typically where volunteers would come in handy is, the reality is we're not going to send a team of Medical Reserve Corps volunteers in to manage an entire event, but they're going to fold into a bigger response as either giving respite to the group of responders that had been working for a shift, or if the operation is escalating and getting bigger and bigger and bigger, they might fit in and help scale that operation up to meet the demand of the community. So that's one thing I like to remind folks is we typically, we don't have you operate as the tip of the spear, but you're a force multiplier. Mm-hmm. You're a group of people that are coming in behind the first responders to help scale up to meet the demand of the community. So that's one example of H1N1. There was a wonderful community response in the Bangor area, and each of our volunteers were part of that. We've also had lots and lots of volunteers that have signed up through Maine Responds that were then able to deploy, on federal operations or other regional operations like in Sandy. During Superstorm Sandy, we certainly had plenty of personnel in Maine go down and help out at alternate care sites and other points of dispensing operations, partly because the people that typically would respond were affected themselves. New York City has a wonderful emergency preparedness program, but all those folks were also dealing with their neighborhoods, their homes, their relatives, and other personal situations as well as work things. That made it difficult for them to respond to an emergency. So that's another valuable asset of the system here in Maine, and especially with the Medical Reserve Corps system where we have units all over the state. If one area is hit hard, they're going to be busy responding in their own capacity or perhaps are unable to respond at all. We can bring outside help in, and that's another value of this program.
And along those lines, I think that answers. I think that's a great comprehensive answer. Along those lines, are there certain geographic areas where you particularly need volunteers in Maine?
It's like anywhere in Maine. There's always kind of a question of, we've got a couple of population centers that have a lot more resources than other parts of Maine. So, I often lean towards saying, yeah, we absolutely need people in Washington County. We absolutely need people in Aroostook County. But the reality is those communities are ultra prepared and typically do a great job of taking care of themselves. And so what I like to say is no matter where you are in the state, there's a public health strike team, a Medical Reserve Corps team associated with your public health district that could use your help. So we typically like to split the state up into rural and urban, or north and south, or haves and have-nots, or however you might do it. But the reality is we need people everywhere, and it might be that the team from Washington County, that's part of the Down East Public Health District, which is Hancock and Washington. Those folks might be the people that come help out, because they're actually going to be closer to Bangor than Portland is. And so even though there's more people in the Portland area that could go respond in Bangor, the reality is we might actually have people more accessible, ready to go right there next door in Hancock or Washington County. So we need people everywhere.
That's great. Thank you. Give another little bit of time to see if there are any more questions.
And I just want to throw this out there. I appreciate everyone bearing with me today with all the snow and everything. I'm doing this from my parents' living room in Pittsfield, far away from my office and the comforts of having all the technology around me. So I hope it went smoothly. I hope people could hear me okay, and I appreciate people participating today. This is an important aspect of public health, and one that doesn't necessarily get a lot of attention, and it's also hard not necessarily being able to share this in a public forum as often as we'd like. So thank you for participating, and I'm really glad that people were able to connect, and I would be happy to answer any other questions offline if folks are unable to call in or type in right now.
That's great, Jared. I want to thank you so much for taking the time to give this webinar and give this comprehensive overview. I know that until we met at the Infectious Disease Conference, I wasn't aware of this program. So I'm so grateful to you for doing the webinar so we can share this with our members and non-members alike. So thank you very much.
Well, my pleasure. Appreciate the opportunity. Thank you.
That's great. I do want to let everyone on the webinar know that our next webinar is Monday, March 6th, also at noon, and that will be led by Diversion Alert, which is a statewide program that provides tools for medical providers to recognize individuals at risk for prescription drug abuse. If you are interested in learning more about that program, you can register for the webinar on our website, mpha23.wildapricot.org. And I want to thank again the Maine AHEC Network and the New England Public Health Training Center for their support of our webinars. And we will see you next month. Thanks again, Jared.
Thank you. Take care.
You too. Bye.